Namaste and welcome back to my channel. So we are going to start with a complete new series that is on the commonly used flaps. We will have its description and then a video on flap markings as well. So we are going to start with one of the commonly used flaps, which is the radial artery forearm flap, also known as the radial artery free flap. Short form is RAFF. So this was first described somewhere around the 1980s by Chinese medical students, hence it is known as the Chinese flap, described by Yang et al. Now the classification of this flap, if we see, it is a fasciocutaneous flap, hence by Cormack and Lambert's classification, it becomes a type C flap. Type C meaning there is a single main source vessel from which multiple perforators rise along the length of the flap and provide its blood supply. If we harvest a portion of the radius along with the flap, the vascularized radius, then in that case it becomes a type D, which means it is an osteocutaneous type of a flap. Now we have different types of flap that can be harvested due to the advent of microvascular surgery. Obviously the commonest one is a free flap, which we are all aware of, but it can also be used as a pedicled flap depending on whether it is proximally based or whether it is based distally. So imagine this as the radial artery forearm flap, which is based on the radial artery, and the skin that we are taking is from the distal part of the forearm. Now the vessels that are supplying it from the proximal end, if we divide it distally, that means we are basing it proximally, then this flap can cover proximal defects, which is around the elbow or the distal arm. But say that we divide it proximally, because it will still have its continuation distally, that is closer to the wrist crease. In that case, we can rotate this flap to help cover distal defects such as the region over the thumb and the dorsum of the hand. So the different types of flap that can be taken is a composite flap or a chimeric flap, where you can also harvest the nerve, palmaris longus tendon or the radius as described. Now the limitation is that when we harvest a part of the radial bone, we can take around 10 to 12 centimeters in length and only 40 centimeters circumference of the bone, so that we maintain the integrity of the forearm. It can be taken as a flow-through flap. Now a flow-through flap means that proximally as well as distally there will be a continuation of the pedicle, and this is used for larger defects when a large part of the skin paddle is required, so that there is a distal as well as a proximal anastomosis at the pedicle to allow better perfusion of the flap. Now an extracorporeal flap is by definition a pedicled flap, but which has gone away from its site. So if we keep this attached, base it proximally, but if I use this flap to cover the defects such as over the region of the scalp, then it is known as an extracorporeal flap. Pre-laminated flap is wherein we will place a framework of the cartilage under the skin of the radial forearm, help it vascularize, and then we will transfer it as a whole for reconstruction, for example in the case of the ear. To perform the modified Allen's test, the examiner must place one hand over the radial artery, other hand over the ulnar artery, feel for the pulsations, then ask the patient to quickly clench and open the fist so as to drain away the blood. Then compress both the arteries together to make sure there is pallor you can see in the hand. Then release the ulnar artery, and filling of the palm should occur in less than 6 seconds, which indicates that the palmar arch is patent and is being supplied through the ulnar artery, which means it is a positive test and that the radial artery can be used for the radial artery forearm flap. This is the modified Allen's test. So what is the original Allen's test? In the original test, both the hands are tested simultaneously by occluding radial and ulnar artery of both the hands for a comparative analysis. In the reverse Allen's test, the principle is the same as a modified test, but in this case, we are going to check the patency of the radial artery and the patency of the palmar arch with filling from the radial artery. So R for reverse Allen's, R for radial artery. There is also a test known as the Barbeau test, which is basically similar to an Allen's test, but in this case the use of a pulse oximeter probe is made to assess the vascularity of the hand. So remember, when we are talking about a radial artery forearm flap, we are talking about a modified Allen's test.